So we've been doing things like changing the commitment law here in Iowa. We're developing the first civil mental health court for Iowa because we already have 5 criminal mental health courts, which are great, and they're doing wonderful work. But we believe very strongly that we should be able to provide that level of care, that level of support and treatment team around people before they get so sick that they end up committing a crime. Um, and we're really working on a lot of state and federal policy. So I'll just say that for now. Um, thank you.
Awesome. Yeah, the civil mental health courts, can you just talk a little bit about what that, obviously being an attorney, that my ears go whoop. So what, tell me a little bit more about that. Like where, is there a particular location that they're starting to plan one in, and where, and how will what's your understanding of how that will work and how that will impact the people that can participate in it?
Absolutely. So we're doing it here in Johnson County because my husband and I live in Iowa City, and obviously our relationships with the local lawyers and providers and other treatment team people are right here. So we've started here. And what it's going to look like is you need to have a really good judge that gets it, that understands that these are illnesses and that they're not crimes. Um, and you basically have a judge bring the people in on a regular basis. It might be weekly, it might be monthly, depending upon how the person is doing. And it's really only for the very tiny percentage of people that have the most serious illnesses but don't know it. They have changes in the frontal and parietal lobes of their brain that make it so that they know they're not sick and they know those meds are poison. And so they repeatedly stop taking their medications, and that's why they get readmitted repeatedly or get arrested repeatedly. So it's just for that very small segment. And that was what we had the law changed for, because before it could be that you could get an outpatient order for treatment only at the time that somebody was in danger of hurting themselves or someone else. And that made no sense because no judge wanted to sign an order for outpatient treatment when somebody's a danger to themselves, right? That makes no sense. So we changed it so that they could write this outpatient order for treatment if the person had been repeatedly hospitalized or repeatedly arrested because of going off of medication. So how it works is that you get an order as the person's coming out of the hospital most frequently, and then they go and they appear in front of the judge, and the judge works with the treatment team. And I thought initially that it was about making the patient compliant, but actually it's about making everybody compliant, because what often happens with people that go off their meds is you have providers throw up their hands in the air and say, oh, your son doesn't have any insight, there's nothing we can do. This is something that we can do. It's a logistical framework to provide the treatment team around them and keep the treatment team compliant as well. And everybody has a vested interest in the well-being of the patient. And you get people that are committing to this. You get people from the substance abuse treatment programs, the outpatient assisted treatment programs. You get people from the hospital. Everybody that needs to collaborate commits to this at the get-go so that the team is there around the person from beginning to end. So that's what we're trying to do.
Yeah, I mean, I believe that all of our courts should work like that. That all of our courts that involve, mental health issues, that involve substance abuse issues, should function like that. For the last couple of years, I've been the attorney and guardian ad litem for all of the kids of the children of participants in our Polk County Recovery Court program. So this is a program that is voluntary, so somebody has to sign up for it, and we have to sort of recruit and educate people about it and ask them if they want to join. I sort of almost think it should be the opposite way, that this is just how we do juvenile court, and then if your case is somehow different, then you can opt out. but the vast majority of juvenile court cases involve drug or alcohol, use that has risen to the level that it's endangering safe parenting, that's not allow the parents to safely parent. And so, and it seems like our powers that be, who are making these decisions, see these specialty court programs as, you know, an extra cost, which, you know, you and I know that it's actually an investment that reduces costs.
Right.
Because these programs, yes, they may technically cost more, you know, when these people are in the program. I mean, it costs more to have them show up every single, in our case, every single Wednesday morning and check in with the judge and go up on the stand and say how they're doing, and, you know, and the whole team is all there to hear that. But the longer term success is so much greater, that it's an investment that really pays off. And for so many of these participants in the recovery court program that I'm a part of, it's clear to me that just that simply that act of showing up every week, knowing that we all expect you to show up, that we're all waiting for you to show up, and that we're all going to support you when you show up,
Right.
and that we're all going to listen to you when you show up, is like, it's like this alchemy, this magic that creates these better outcomes, because a lot of these people have such significant childhood trauma themselves. And for a lot of them, they say, you know, like, this is the first time I have felt like I've been really listened to. This is the first time I felt like I've been really supported. And so, you know, being able to provide that is really important. That's interesting.
Exactly. Yeah. And these courts, the mental health courts specifically, there's a program down in Dade County in Florida that Judge Steve Leifman's been running. He's actually been able to close an entire jail. And they've saved so many millions of dollars that they're taking that building and converting it into a treatment facility so that they can provide all sorts of outpatient treatment and job training and so many positive things that are actually adding people back into being taxpayers and functional citizens, which is awesome. So yes, they save a lot of money. And in every program that we've seen, they've saved at least 50% in cost, especially from the reduced hospitalizations.
Yeah, exactly. Wow, that's amazing. So yeah, we will, I think now, if anybody has questions, let me pop over and see if anybody's popped anything. I don't see anybody's asked anything in the QA. Carrie has shared to everyone here, typed in that that Carrie, she's a recovering alcoholic and has depression and anxiety. Yep. And I wonder, Carrie, how is it, and you can share, you can just put don't want to say or something if you don't want to, but if you want to, how are you doing? How are you doing with the COVID-19 pandemic, as far as not being able to, like, I know for a lot of our recovery court participants, we have an issue where they really, that in-person connection and showing up to NA or AA meetings in person is really important for them. And a thing that people say in the recovery community a lot is that the self-isolating is really dangerous. And now we have to self-isolate. So I hope you're doing okay, and that you're reaching out to people as much as you can.
And I would just say that here in Johnson County, we just had our NAMI board meeting this week, and we learned, unfortunately, that they are seeing an increased number of suicides and suicide calls into our mobile crisis hotline. It is a huge issue, and people are trying to do telehealth and phone calls. And from our peer place recovery center, we have not been able to have it open. So we've been doing calls to all of the patients that have usually come, and that's been helpful. But another issue that's come up federally is that there's a lot of people with both physical and mental disabilities that have limited phone minutes. And so we've actually been advocating with the FCC to require the wireless companies to stop the limits until the end of the pandemic, to try to allow those people to have better access for care and connecting with people, both any person in addition to their professionals.
That's such an important point, Leslie, is that, you know, all of us who have the means to do so, we'll just hop on our laptops and do a Zoom, right? And we just think nothing of it. And people that are living in poverty, who don't have the resources to have a laptop that's Zoom capable, if they have a laptop at all, or they don't even have a smartphone. They might
Right.
have if they have a phone at all, it might be the lowest level flip phone that doesn't have any kind of smart capabilities to stream something, or
Mhm.
and then they run into the minutes limits. They may be out of minutes. And then in very rural areas in this country, we still don't have nationwide high-speed internet,
Right.
as a public utility, sort of an entity like that. And gosh darn it, if we can electrify the whole country in the 30s and and into the 40s and get everybody having electricity no matter where they lived, I fail to understand why we can't have everybody having high-speed internet, at least the availability of that everywhere, and we really don't. So some people that live in rural communities, even within an hour and a half of Des Moines, they don't have. It's very patchwork,
Right.
they are. Some people would rather work from home, and they're allowed to do that. They can't do it. They have to drive into Des Moines to their office because they don't have high speed internet where they live, and that's a huge barrier, especially highlighted in a pandemic like this where we needed to stay home, of how many people don't have ready access to the technology to connect with other people. We have a couple questions.
Mhm.
James Van Steenberg, did I do it? Did I say it right? Van Steenberg. He says he's a NAMI peer-to-peer teacher, connection support and recovery facilitator, and in our own voice presenter, and a NAMI Dubuque board member. Hey, James. Awesome. He asks, are you looking into any peer support specialist programs that can work with peers to help peers develop treatment programs?
Mhm. So at NAMI Johnson County, I'm happy to tell you, and you probably know this, James, but we have peer-to-peer support groups, peer-to-peer education programs, and we also have our Place Peer Recovery Center. And our Peer Recovery Center is entirely peer-run. We have Jen Day, who is our supervisor of that facility. And it's open 5 days a week in the afternoons normally, not right now during the pandemic, but normally. And then we have several peer support specialists that work there on those various days. And it is hugely successful because, as you know, so much more can happen and people open up so much more when it's peer to peer, as opposed to a professional telling a person some of the similar kind of information. It's very different when you're being supported by and educated by somebody who's gone through the same experience. And on the same level, we also obviously do family to family and family support groups. And you know this, the NAMI people are all trained by NAMI, and so it's a very effective and gold standard program all the way around.
Yeah. And NAMI, I don't want to get it wrong. Give us that for people who happen to be on the call who might not know. NAMI stands for, I know it's something mental. And go ahead.
Yeah, it's the National Alliance on Mental Illness, and it's
National
a
Alliance on Mental Illness. Okay,
you got
great.
it. And it's a grassroots, volunteer-based nonprofit, 401(c) or whatever you call that, organization that's primarily held up by fund. That's how we raise our money, is through NAMI walks and other fundraisers that we have through the year. But we provide all of our services for free to people with mental illnesses and their families because we don't want them to have to worry about finances when they're in crisis or needing support.
I think it would be amazing if someday in this country, this moral and wealthy nation, that we had a healthcare system that included any and all mental health care and access. And it would be just like going to a library to get your treatment. You would hand them your healthcare card, you would get your mental health treatment, and you would walk out and you'd never get a separate bill. You wouldn't take out your debit card.
That would be awesome. You're absolutely right. And we have
We
parity
got to
right
keep
now,
going.
right? We have parity. That is the law, but it is not the reality. And so one of the things we need to do from a policy perspective is, as we go forward with various things, we also have to build in monitoring and accountability and build in fines and things like that to make sure that these things happen. It's one of the things you learn as you go along, is you have to build in a lot more into things than you initially think you have to.
Mm-hmm. Yep,
Yep.
absolutely. Can somebody from my team who's on the call drop into the chat the I think Tim went and looked up the, I don't know if it was a NAMI specific number, but it was like a suicide prevention hotline number. And I wanted to give that during this, to, speak about that and give that number out during this forum. So if somebody can drop it in the link, that would be great. I think it's under the mental health forum in our Slack channel. Jeff asks, how are these issues addressed at the national level rather than the state and local levels? And Leslie, I'm going to just let you go because I know you know all the intricacies of this. So go for it.
Right, right. So there are certain things that are very much based upon federal policy, and one of the long-standing federal policies that's been in place has been dated back to 1965 with the Medicaid Act of 1965 that LBJ signed. And it limits the number of hospital beds or facility beds to 16 or less for people with mental diseases. It's called the IMD exclusion, and it's a policy that's been in place since then. But what it does is it means that any facility with more than 16 beds dedicated for people with either a mental illness or an intellectual deficit cannot receive federal matching Medicaid dollars. And so that's been one of the biggest forces that's caused us to over deinstitutionalize. And it has led to so many limitations for being able to get somebody hospitalized when they need it, but especially for long-term care. And here in Iowa, that's a real big problem because we only have 64 beds for adults and 32 for children. And so it's been a huge problem. And I'm not saying that everybody with a mental illness needs to get into long-term care. That's not it at all. But the scale of the limitation of beds is really the problem. It limits beds in our hospitals for acute care because people that really need long-term care have no place to go. And so they stagnate in the hospital beds, and then somebody presenting acutely cannot get in. And yes, you're absolutely right. Iowa is 51st in the nation. You're exactly right, dead last. So that's a policy that we are very strongly advocating, and we spent a lot of time dealing with all the presidential candidates coming through. And the really good news is that we now have at least 4 senators that all understand that this needs to change. Hopefully we'll have another senator soon, right? And also Governor Bullock was on board, and he's running for Senate as well in Montana. He actually came out with an outstanding plan for mental illness. And that's just one example. Other things that we're hoping to negotiate are improvements in the HIPAA law to allow for better collaboration with family members who are definitely strongly supporting their loved ones. That's been a huge stumbling block in terms of being able to provide reasonable care and have good communication about what's going on. So there's certain things that are federal laws and certain things that are national laws, and we need to come at it in a multi-tiered way, as well as trying to get a hold of some federal dollars for things like those mental health courts. We could have a huge influx of money that would really make a difference, and even money for brick and mortar, building new hospitals, or what I would like to build are psychiatric assisted living facilities with multiple levels of care. If I were to win the lottery, that's what I would do. But so there are a lot of different things that we're working on. And thankfully, we're still working with Senator Cory Booker right now on national legislation.
Good. Yeah. I had the opportunity because I got to speak at a lot of the same events that presidential candidates got to speak at. And I had the opportunity to talk to Governor Bullock a couple of times, just, backstage on the side, whatever, when we were waiting to speak or something like that. And I found him to be just really a genuine, just my gut feeling was just a very genuine person who really wants to help people and make people's lives better. And I was also very impressed with what he was able to do, what he's been able to achieve in Montana as a Democratic governor, with a Republican House and Senate in his own state, Republican majority legislature, including making some strides in getting dark money out of their elections there in Montana. So I hope, I'm behind Governor Bullock running for Senate all the way, and I hope that he makes it. And then I hope they get another good Democrat to be their governor after that as well. Okay, so Jeff, it sounds like, funding, of course, is an issue. That's one major issue, that these issues can be addressed at the national level, and then the HIPAA, definitely, changing the federal HIPAA law to allow more collaboration. I think almost all of us, ever since HIPAA laws went into effect, have run into situations where there's no actual reason for a private provider not to be communicating with a family member, that everybody wants to be able to communicate, but for whatever reason there's no ability to do that, and especially when something is urgent in the spur of the moment, in the heat of the moment, sometimes that's not allowed. And believe me, I understand also the need for privacy, so I realize that's a balancing issue.
Hmm.
But it has proved to be an impediment in a lot of serious situations as well. It's like a lot of things in life, it's a double-edged sword. um, James Steinberg asked if there's any federal programs that can help fund peer help programs, any federal funding that helps peer help programs, peer-to-peer programs.
Yeah. Actually, our peer-to-peer program is getting reimbursement through the East Central region for our MHDS region. So I believe that's possible in other regions as well, depending upon how healthy your region is. But you're in Dubuque, so you're in the same region. So you might reach out to May Hinshin, who's the new CEO there, to see if you can get some funding if you aren't already. So absolutely, that is something that should be reimbursed. I don't know the amount of reimbursement, but it should be reimbursed. And I think it should all come through the insurance as well. But I don't know the specific details on that. Yeah.
Nancy,
And
go,
one other
go
Can I
ahead,
share
Leslie.
one other thing? Another federal policy specifically that we've been working on is currently, if you're involved in the criminal justice system at all, in a prison, in a jail, or even on probation, you can't have Medicaid pay for medical care. And that's another policy that we are really hoping to change. Yes, you didn't know that. Wow, it's a biggie. That is a huge problem. And that's part of the reason why sometimes people go into a prison or jail and can't get the meds they need, because the prison doesn't have the funding to support that particular med. So yeah, people go back into a psychosis because they have to change their medication or not take any medication until that gets figured out.
I mean, I've run into that problem over and over, but I didn't know why. I didn't know why. I thought it was always just an issue of like communication between like the person's doctor and the prison or the jail. And you know what I mean? Like I've, you know, I've never gotten into the nitty gritty of why that's an issue. That sounds so much like how you can't get access to affordable housing if you have any kind of criminal history
Right.
using the Section 8 program and so forth. It's like, but then we're just we're just we're just kicking these people when they're down, not even giving them even a hand up, just basically pushing them back off the ladder when they're desperately trying to get, climb back up. So again, it goes back to investments. If we refuse to invest in people, especially when they're at that point in their lives, at those critical points when they need all the support they can get, then we're going to see these continuous negative outcomes. Okay. Anyway,
Sorry.
I know. No, I definitely need to know, and I'm very glad I do know that now. So Carrie just commented, I wish Governor Bullock was for single payer. Me too, Carrie. Maybe we can, you know what? If Governor Bullock and I both end up in the US Senate, I'll see what I can do. I'll see what I can do. Maybe I see a lot of lunches with Governor Bullock in my future. Susanna. Hey, Susanna. Susanna says, do you think teletherapy could or should become more common and funded through things like high-speed internet, and making like high-speed internet more widely available? She worked in Washington State for a short time with a woman farmer who was also a teletherapist due to her living remotely, far away from large populations. She said the online programs she worked with had been able to reach a lot of patients that would not have seen a therapist otherwise, either due to their own fear or limitations, or cost. And especially after seeing the response and use of tech for mental health during the pandemic, it seems like it might be a good idea to invest in online means into the future. Yeah, I mean, Susanna, I'm all for whatever gets the most people the most help, and that I do think my only caveat, and it's not a caveat that keeps me from at all from supporting the idea. I'm 100% supportive of the idea. My only caveat is that human beings, and I'm making a vastly general statement here, okay? There's always going to be exceptions. Human beings are kind of wired for connection. Human beings are wired for in-person connection, right? Um, we're mammals. We keep our young like with us, on us, around us, like when they're little, like that's what mammals do. And we're in the mammal kingdom, right? And so I think there's huge value to physically going and sitting with a person who's listening to you, you know, and getting mental health therapy in that in-person way. And not really a but, it's an and. If that's not possible, or if that's not for any reason, then 100% we need to be having high-speed internet everywhere in the country, and everyone should have access to mental health care, however that can happen, whatever's the easiest way for that can happen. What are your thoughts on that, Leslie?
Yeah, so one of the positive things that might come out of this pandemic, because I'm looking for positives, who isn't, right, is that maybe it will help people to connect more with getting some therapy for themselves. And I think of rural Iowa. I think of the rural farmer who doesn't want to drive his pickup into town and go into the parking lot of a facility where the people, everybody in town would know that that person was going to seek mental health care. So
Right.
positive thing is now that farmer could access that therapist or psychiatrist or doctor about this issue. So that could be one positive outcome of it,
Absolutely.
as well
Absolutely.
as getting the people to pay for it, getting the insurance companies to pay for it. And that is being done, that they are paying for that. And they're also paying for telephone care only for those people that don't have internet and have to just be able to talk on the phone. So
Right.
those are some positive things to see that they will realize that they can do.
Yeah, that is a tiny sliver of silver lining in any of this, is that I've seen that those announcements that insurance companies are paying for telemedicine now, which they refused to do before. And I hope, and I'm hopeful, and I hope that they won't go back, that once this pandemic is over, they won't then reverse course and say, oh, now we're going back to where you have to have in person. I hope that they understand the value of it, and that they'll keep going forward like that. Karen says, would you list 3 things the average citizen can do to help reduce the stigma of mental illness?
Okay, I'll take. So I have a couple things to say about stigma, and I'll apologize to Kim in advance because she's heard me say this
That's
before.
okay.
Um, I will. I do think we need to reduce stigma. My theory on it is that we've spent enough money on PR campaigns. There's been millions of dollars spent in our country to reduce stigma, and yet we still know it's there. It's there both on a personal basis and on a systemic basis, right? So I think if we want to get rid of stigma, we need to start calling these disorders what they are. Say depression, say schizophrenia, say bipolar disorder. Just naming them makes a huge difference. I think it just automatically destigmatizes it. And I think back to when I was a kid and people used to whisper cancer, and that was
Right,
ridiculous. And
right.
now we all talk about cancer, right? So, in terms of reducing stigma, I think it's really more important for us to increase funding for treatment, especially the people with the most who make up our homeless population, make up our population of the few unfortunate people who, while off medications, might actually commit a crime. And also the people that end up in our prisons and jails. If we do a better job of treating people and keeping everybody healthier and functioning better in society, it makes it less scary for everybody, including their experience of their illnesses. So the humane thing to do is actually the thing that will help to reduce the stigma and discrimination the most. But just talking about it openly, I think, is a huge factor.
Yeah, it's like it's this, Karen. It's what we're doing right here today. It's just talking about brain disorders and chemical imbalance disorders. How are we, for what they are, saying what they actually are, and reducing the just sort of, I guess, maybe maybe us all sort of shifting to letting go of even that word stigma in regards to, so that we don't couple it up with mental illness any longer, and we simply just cut right to the chase and we talk about what we're talking about, right? Um, I remember. I remember when, this is how old I am, y'all. I remember when Betty Ford got breast cancer. And that was, I remember her talking about it, going on TV shows and talking about it. And at least in my memory, that was one of the first times that a very well-known person who got cancer, and not even cancer, but breast cancer, right? Breast cancer, was talking about it openly. And now, I mean, I don't know anyone who hesitates before saying, oh, my friend just got diagnosed with breast cancer. Like, we're not like, oh, this is something we maybe shouldn't talk about. And so that's how far we've come in all of those years. And I think that we're on the same track with brain disorders and with other kinds of illness, that we just talk about the illness and we don't necessarily label it like that. Darrow asks, are there certain cities or counties in Iowa that have mental health policies that do work well, that we can look to as examples of how those policies were achieved and how to get them adopted in more locations? Well, I'll let Leslie talk more, but I would say, looks like Iowa City has got, with their courts that they've got going, that's a huge positive. I'm not aware, maybe there is, you know what? No, I think I did send an email to a friend of mine who does criminal defense work here in Des Moines. And I think we do have I don't do criminal defense. I did earlier in my career, but I don't now. So I didn't know, but I believe he told me there's a mental health criminal court here in Des Moines as well.
There could be. There's 5 counties that have criminal mental health courts, and I know for sure there's one in Scott, Pottawatomie, the county where Sioux City is. I'm trying to think. Yes, thank you.
Yep.
And Story County, and there's one other one. So it could be that is.
Oh, maybe it's both.
Yeah, it could be. The other thing I would tell you is that in terms of programs, there is a first episode psychosis program at Broadlawns. It's our only one of that nature in the state, and that's another goal of ours, is to try to get more of those programs going. And when I met with the new director of DHS, Kelly Garcia, who's outstanding, by the way, she was very supportive of that idea. She had helped facilitate the expansion of those in Texas before she came here. So I'm hoping that that's something I'm trying to get done and encourage or facilitate, since I'm not in charge of anything, but I advocate for. I'm trying to advocate for that here at the University of Iowa as well, because I think those programs are hugely successful for doing a better job of engaging with the patient and educating the patient and family at the very first onset of the severity of a psychosis. So those are some examples.
Yep. Carrie has a comment. She just says her daughter suffers from mental health and addiction issues, and it's hard on us and on her children. Yep. She won't accept that she has a problem. We tried to get her committed, and that was a nightmare. Their lawyer that was supposed to help from the state was against them, and the judge was very mean. I'm so sorry that you had that experience, Carrie. That sucks. I'm so sorry. Not everybody who is either a lawyer, a judge, a DHS worker, not everybody who ends up in those jobs has the understanding of all of this that they should have and that they need to have. And that's really awful. And, I know, and I hope, and I know that people like Leslie, and then us having this conversation, and then, I hope that whatever happens after June 2nd, whether I go on to this primary or through this primary and go on to run against Ernst, or whether I don't, I'm somebody who, through meeting Leslie and her husband Scott, and who learning more and reading this, working on this book that Scott and Leslie gave me, which, by the way, I'll just let everybody know, it's called Insane Consequences: How the Mental Health Industry Fails the Mentally Ill, and it's by DJ Jaffe. And as Leslie said, it's a little dry, but it is just packed with fantastic information. And for those of you who just want to better understand what's going on systemically with our mental health system, if you will, in this country, this is a really, really good book to get your hands on.
Can I comment too to that, Kim?
Absolutely.
Okay, so Carrie, I am so sorry that you've had that experience, and I will agree with Kim that there's people in every profession, every walk of life that don't understand and don't get it, that these are medical illnesses. And if you haven't gotten to a family-to-family class, I would strongly urge you to do that, because it becomes a little bit easier when you connect with other people that have been through the similar experience. If you've already been, great. The other thing I would tell you is that I retired from my job as a physical therapist this past fall. And part of what I'm doing, in addition to working on policy, is going around all over the state right now via Zoom like this, and giving advocacy talks. So if you have a group of people that you're associated with or would like educated, feel free to pass on information about me. And my email is lcarpenter@iamentalhealth.com. You'd be more than welcome to write to me. I believe that we have to make a change with that, and the only way we can is through education. So I'm spending a lot of my time educating people from all sorts of professions and walks of life.
Awesome. Bye, James. I'll make sure Leslie gets your email as well.
Oh, I see. Great.
Would like more info on the peer. He'd like info about the peer support hotline also as
Yep.
well. We'll hook you up. Yeah, and Carrie, I'd say one more thing. Just as somebody who, like almost everyone, who has had close family members with, I've also had a close family member with a substance abuse addiction issue at some point. It is horrifying and it's painful, and I don't know if you're already involved with, I know you're involved in like NA or AA, but I don't know if you're involved with Al-Anon. But part of what eventually may have to happen is that you understand that you can't make somebody want to get addiction treatment. You can't make someone, you can't, I mean, really, unless you can prove that, to a judge that they're a danger to themselves or others, and in which case, as we all unfortunately know, that's really not going to get you very far anyway. I mean, at best, you're going to get them committed for a very short period of time, and then typically they're back where they started. It's horrible, but that's,
Yep.
yeah.
And Carrie, I have one more comment. I have just been reading a book. I'm trying to get it so you can see it. I don't know if you can.
You're great, like your lovely beach scene.
Oh, won't let it show.
So we can't see it.
Well, I'll tell you the name of it. Sorry about that.
That's
It's
okay.
called I'm Not Sick, I Don't Need Help. And it's written by Xavier Amador. And it's really all to deal with the whole issue of a certain percentage of the patients that don't know that they're sick. And he gives very specific advice about how to make the connection with the person, how to engage with the person to help them at least get the concept of the medication, helping them to stay out of the hospital and helping them to feel better. And it's really good. I wish I had read it 10 years ago. So I'd highly recommend, if you don't know about that book, get a hold of it and read it, because it really does help.
Can somebody on our team, Khadijah, can you type I'm going to have Leslie say it again and slowly, and then can you type it into the chat? What's it called, Leslie?
It's called I Am Not Sick, I Don't Need Help, and it's by Xavier, Xavier Amador, Amador.
Cool, thanks. So yeah, did I miss any questions?
Over in the chat, there's somebody that asked about thoughts on research into psychedelic therapy.
Oh yeah, I don't know. I have to say I'm ignorant on that entirely, but I'm sure Leslie might not be. So if you want to say something about that, Leslie.
Sure. I have a couple comments. One is I don't know about any research in terms of psychedelic therapy. I will tell you that one of the biggest things that we've also been advocating for is to reclassify schizophrenia as a neurological disorder in terms of how it's classified, specifically for people that do research, because we really do need more funding to go into all sorts of different research on medication, on causes, on other effective treatments to help. I will make the comment that, and this may not be a very popular comment, but our son's drug of choice when he has been self-medicating over the course of his illness has been marijuana. And I don't have any strong feelings for or against marijuana. I do think there's a lot of really good medical uses for it. But I know for him, specifically THC, has put him back into psychosis every time he's used it. So for certain numbers, again, a small portion, some people are very susceptible to the addiction to it, but also for it causing their psychosis. So for him, that's not been helpful, but CBD has actually been helpful for the anxiety associated with his schizophrenia and his voices. So it's complicated, is what I would tell you, and that's one of the fears I have.
It is.
Yeah.
And it's not one size fits all. That's the other thing too. Like, I have actually a friend of mine that I've known for, gosh, almost 20 years, since our kids were both little, tiny babies. And her name's Judy. Hi, Judy, if you end up seeing this. She has a significant serious brain disease history in her family, like virtually many of her relatives, I think including her mother, if I'm not mistaken, suffered from, I don't recall specifically which, if it was schizophrenia, I believe it was, and I could be wrong, or if it was like paranoid psychosis, I don't recall, but I've heard Judy talk about this over the years when we, group of friends that have known each other for a long time, get into discussion about the legalization of marijuana. And, you know, I think it's just important to have a full discussion and understand that none of this is like, it's not one size fits all. And I just want to be clear, just so people understand, my position is I believe that marijuana should be decriminalized at the federal level. I don't think anybody should be getting a criminal record or going to prison for marijuana use. That to me is absurd. And I do believe that it should be legalized. This is just my personal platform and my personal position as somebody running for United States Senate. I believe it should be legalized federally for medicinal use, but that would be as a medicine, you know, just like any other potential medicine that could be prescribed by a physician in close consultation with their patient, so that, again, we understand this isn't one size fits all. Different drugs affect different people differently. I remember this is not regards to marijuana, but just illustrating different drugs affect different people differently. I had a surgical breast biopsy for suspected breast cancer. It was not breast cancer, but suspected breast cancer many years ago now, maybe 12, 15 years ago. And when I came home, they gave me a bottle of 30 Vicodin tablets. And the instruction on the bottle said for me to take 2 every, I don't remember the number of hours, like every 6 hours, I don't remember the number of hours, but every so whatever often. Well, I know that my body goes crazy. Like anything I put in my body seems very sensitive to. So for example, I take like half doses of allergy medications. I take half doses, like children's doses of, so it said take 2. So I took one single Vicodin pill, and I slept for about 15 hours, and I never took another one. And the 29 pills sat there for years. And I mean, somebody else might have needed 2 every 4 hours or 2 every 6 hours to control their pain. It's just a tiny illustration of everyone's body chemistry is a little different, and how medications are going to affect them might be a little bit different, and that we just need to know that, you know, and be aware of that.
I would agree. One of the positive things that could come out of legalization too is to actually have it regulated so that people know what it is they're purchasing and what they're using. And as long as we also do a really good job with an education campaign so people understand about the adverse effects on teenage brains, because it really truly does have a lot of slowing of development, and they're now being shown correlation to schizophrenia and psychosis. So education, but yes, it needs to be decriminalized for sure.
Yeah, absolutely. So I don't see any other questions open right now. So if there's anything else that you want to, oops, maybe there is one. Hold on. Oh, nope. Yep, there's one. Genevieve, Cleverly. I'm curious, Genevieve, if you're any relation to Larry Cleverly, who I bought fantastic food from for 20 years at the farmer's market. Anyway, Genevieve says, I'm curious about your thoughts on trauma-informed care. Are there ways, oh yes, oh boy, that's, yes, super important, incredibly critically important. Are there ways in which awareness and impact of trauma and things like ACEs scores could continue to shape policy? I'm specifically thinking of school, healthcare, criminal justice, because of the prevalence of people who've experienced trauma that go through those systems. Yes, thank you for mentioning that. One, I don't, 1,000% really isn't a thing, but if there was, I'd say 1,000%. Yes. The people that I work with in recovery court have all across the board. I can't, I'm just clicking through my brain about the people I've worked with in the last few years, and I'm not even hitting on one that didn't have significant childhood trauma or traumas, from many different, they maybe grew up in poverty, plus they were sexually abused, plus their parents had domestic violence issues, plus, I mean, on and on and on and on, various stacking issues. And so, Genevieve, I think that actually everyone who is in the whose work it is to provide services in schools, in healthcare, in criminal justice system, in providing mental health, provide anybody who provides those kinds of services from one human being to another, I think needs to have significant training in trauma-informed care. And I'm not talking about an afternoon webinar. I'm talking about, hours and hours and hours and hours and hours and hours, and ongoing as well. And the good news, some little sliver of good news, is that I have noticed recently that our judges here in Iowa have, at least in Polk County, I can't speak to the other counties, but I remember seeing an announcement, just an announcement about a trauma-informed, trauma-informed care or trauma-informed practice, trauma-informed judge, like CLE or something that they were providing to judges. So I think that message is too slowly, but slowly getting out there, and is definitely having a good impact. And we who work in recovery court have that kind of training. Almost all of us have it individually anyway, just because of the kinds of services that we typically provide. But we've also had a little bit of continuing education about trauma-informed care. Anything else you want to say about that, Leslie?
Sure. So trauma-informed care, there's sometimes a misconception, and I don't think you have this, Genevieve, but some people in the world tend to have the misconception that that means that everybody with a mental illness has a mental illness because they experience trauma, and that's not the case, as you probably well know. But what I would say is that every person with some type of a brain disorder who has sought medical care ended up experiencing trauma just by going in to get medical care for their brain disorder. And it took me a long time to recognize that it also happens to the family members as well. In fact, I didn't really realize that I had been traumatized through the course of all of our son's hospitalizations until I took the NAMI provider training course, and we were talking on this exact subject. And it occurred to me, oh my God, yeah, I've been traumatized and I had never really thought about it or processed it. But that's one thing that we do a good job of with our provider training courses that we do. And I would say that yes, hours and hours would be great, but we've had an impact even with just our 4-hour seminar that when we provide a shortened version of our provider training class to direct care providers, to nurse practitioners, and to docs. It makes a huge difference for them to understand what it is like for somebody who experiences an onset of a mental illness from the get-go, and what it's like for them to go to the ED or ride in the back of the sheriff's car across the state
Mhm.
to go to another hospital, all maybe 4 or 5 hours away from their family.
Right.
Just how traumatizing even that experience is. So much could be done on that, and the good news is that it's starting. We are making some headway on that.
Yep, definitely. Um, Jay Hughes says, how like having ADHD is considered a bad thing, and how to help people learn how to make it like an advantage or consider an advantage, and how people can do more and not like label people as having ADHD as a negative thing. And so that he has ADHD. Um, yeah, and medication is there to that helps some people. Yeah, exactly. A lot of these things, again, it's just for talking about it very plainly, I think, and for what it is. And so you talking about it is great, because the more that you talk about it and the more that people that have ADHD talk about it, then we start to just see that as one portion of who somebody is, and not just a label that we slap on their forehead, and then unfortunately sometimes just dismiss people because of this one piece of all of the patchwork that makes up who they are. Yeah. Carrie says her sister died of an accidental drug overdose of prescription drugs. Oh, I'm so sorry. I don't, Carrie asked if there's anything the state is doing to crack down on doctors that overprescribe medications. I really don't know. I mean, I would hope so.
I would answer that I think that the state and the federal government are really cracking down on doctors in terms of overprescribing pain medicine specifically, but I don't know as if that's all encompassing in terms of other types of medications that could produce those results.
Yeah.
But they are definitely working on educating doctors about the appropriate dosing, and potentially there's a lot more prescribing. I'm a PT, so I know that when people are undergoing like orthopedic surgeries, more often now they're being prescribed just to alternate between Advil and Tylenol, or just Tylenol, and they're not even being given a prescription for Vicodin, for instance.
Right.
That's happening less.
Yeah, and that too is a double-edged sword. So we have to think through a lot of this through to its logical conclusions, because again, it's person to person to person. Everyone has individual needs and individual levels of pain, and so I've heard people have talked to me about this, that they can't get enough pain medication for their severe pain.
Right.
And so that can become a problem too. And that's kind of where again, this is not a one size fits all, but for some people who live with chronic pain, something like marijuana could replace the opioids that they're currently using. And the notion that we don't have that available, and yet we have all of these other pharmaceuticals available, is just not okay with me. I mean, that's just absurd. I have a family member who is very much helped, and who's a person with a disability, and who lives with chronic pain, and who's very much helped by being able to use marijuana medicinally. And he lives in Iowa, and he can't legally do that at this point, which is absurd. And then we have Illinois now, a few hours away, or in your case, not even a few hours away of where you live, Leslie.
Mm-hmm.
And then we have Colorado. I mean, as more and more states legalize this around us, it becomes even more absurd, because come on, if you're in that much pain, you're going to probably go across the border to alleviate your pain. I mean, being in chronic pain is no joke. And until you're somebody who lives every day in chronic pain, you, you can try to imagine it, but you have no idea. And that goes for me too. The very few times in my life, fortunately, it's been very few, when I've been in what I consider pretty bad pain for a day or two. You know, imagining living like that every single day of your life and being unable to control that physical pain is just horrific. It's horrific, and we need better ways of controlling people's pain. And there's a lot of different things that could be explored that I think aren't explored or used enough, probably. Hi, James. James said, and then I think this is the last question we're going to take because we're going to wrap it up. James says, are kids being diagnosed with ADHD too early before you can tell if this is really what they have? I am like so the opposite of an expert on ADHD, James, that I really wouldn't. I personally, I mean, Leslie may have, because being involved with NAMI and just having more expertise in the whole mental health area, may know more about that. Yeah, it's interesting. You know, I don't know in some cases whether it's that this has been something that has existed throughout time, and then we've only become aware of it, and so now we're only diagnosing it, just like autism, for example. There are a lot of people who are around my age, 40, 50, 60 years old, who very well may be on the autism spectrum, but nobody was diagnosing or testing or knew what that was 40 years ago when they were 3, 4, 5 years old. So they were never diagnosed, right, with that. So as far as ADHD, I don't know. What do you think, Leslie?
Yeah, I would tell you that I'm not a pediatric specialist in terms of my knowledge base. I think it's possible, but I think also it's still a case-by-case basis. I think it's one of those things where I wouldn't want to make a generalization. I do know that I just recently spoke at an event, and the person that spoke right after me, her talk, she is a nurse who treats pediatric psychiatric patients, and she labeled her talk "The Rage," and wow, that really sort of shocked me, and it set me back. And she was talking about that everything was due to bad parenting. So I think either extreme can be pretty scary in terms of people feeling all one or all the other. I think there needs to be a case-by-case basis, and being very careful with diagnosing, and that takes a lot of patience and a lot of time. But yeah, I worry that you might be right, but I don't know.
Yeah, again, I am absolutely positively no expert. I'm no doctor. I just have parented one child. So I have a test case of one, which is very, very, insignificant, as far as being able to make any kind of sweeping generalizations. I absolutely can't. All of that said, I would always be very careful myself personally. I would not want to say X is due to poor parenting. Y is always due to poor parenting, because I've just personally in my lifetime seen so many parents that I personally have known that I, at least from my vantage point, which I understand, I'm not in their home 24/7, right? I don't know, but from what I've seen, appear to be very good parents. And brain chemistry doesn't care what kind of parent you have. Brain chemistry and things that can go wrong with brain chemistry don't care at all. I think what kind of parenting that young child or that teenager, that adolescent, that young person has had. And so, I can understand the propensity, especially maybe with ADHD, because I've heard the argument, I think like we all have, that is that because we're putting kids in front of their iPads from infancy, and everything's flashy and bright and look at this, look at this, look at this, look at this. And we're like encouraging a short attention span by the screens, which are designed to become addictive. Like, is that one of the biggest problems? I don't know. And I can understand that argument. I can understand the argument that it has zero to do with that. But like most answers to questions like this, where we say, is it nature? Is it nurture? Right? Is it nature? Is it nurture? I think the answer is usually yes. It's some of it's in your DNA, you know, how you're going to be as a human being and what's going to happen to you and what's predetermined by your genetic code, chemicals in your body. And then it can be shaped and it's perhaps by what kind of parenting you had, what kind of home you grew up in. Did you grow up in poverty? Did you grow up with a more stable home environment where you didn't have to move around so much? And that may help mitigate some of the things that otherwise may be heightened if you grow up with less stability and you grow up, you know, it's not simple. And I know that in these times, you know, it's kind of microwave, quick, now, me, you know, we want an answer, we want it now. And that's just not how humans work. That's just not how humans work. So, but I think we're going to wrap it up. Leslie, thank you so much. I really appreciate you being here and appreciate all the valuable information. And people can contact NAMI for more resources on any of these things that we've talked about. They're a fantastic organization. For more information, if you want more information about us, our campaign for U.S. Senate, a couple of things I want to say. The first thing is KimberlyForIowa.com. You can go to KimberlyForIowa.com. You can volunteer there. We would love to have, if you have any extra time because you're not driving anywhere now, you can lend your text bank or phone bank. We obviously are not knocking on doors, so you can text bank or phone bank. Text banking is usually good for extreme introverts because you don't actually talk to anybody, you just type. And it's a very effective way for us to reach voters. And the other thing is, obviously, if you are having a hard time financially, even before the pandemic, and especially now with the pandemic, ignore the next sentence. Take care of your family and yourself and your friends first. If you have extra money, help your friends out who need it, help your family out who needs it. If you have any more money, we would love to gratefully accept it into our campaign because we're a truly grassroots campaign. We don't take corporate PAC money. We don't take corporate lobbyist money. We literally have an average total of all of our donations. Our average donation is $25. So that's a few higher than that and a lot lower than that. We have a lot of $1, $5, $10 donations, and we love all of it and welcome all of it. And it all goes to good causes. We have a very lean and mean small staff for a U.S. Senate campaign. And in spite of that, we won the Des Moines Register Mediacom poll that was done about 3 weeks ago. We have the most name recognition and the most favorability. So we're doing better than all the other candidates running on the Democratic side for this seat. And I think it's because I put 40,000 miles on my car between last June and March. And I went everywhere and talked to everyone, which is how you win Iowa. There are no shortcuts. So, anyway, we would love to have your help any way that you want to give it. And as far as voting, even if the polls are open, please do not go to the polls. Please do not go to the polls. That's right. I'm up for election. I'm asking you not to go to the polls. Instead, I want you to get your absentee ballot request form, which you will be sent automatically this year. So you're going to receive in the mail an absentee ballot request form. When you get that, send it back in. You have to fill it out, send it back in. So we got 2 steps here. Get your absentee ballot request form, send that in. They'll send you a ballot, fill that out, send that in, and then you're done. So we got a 2-step process this year. And you can start actually requesting your absentee ballot now. You don't have to wait for them to send it to you if you don't want to. You could do that now. So thanks everyone for being here. Thank you so much, Leslie, and say hi to Scott. And
he says hi.
Hi, and we'll talk to everybody soon. Tonight, I'm going to be on with JD Scholten, doing an interview with him over on his Facebook. It's either at 5 or 6. I can't remember, but if you go to JD Scholten's page, you'll find out when it is. So tune in there if you want to see an interview with JD Scholten and I chatting. And then tomorrow at 11 a.m., we have an immigration roundtable with Sonia Paros Conrad, who I was lucky to go to law school with, and she's been an immigration attorney for the last 20 years or so here in Des Moines, and she will be on with us tomorrow. 6 o'clock. Thank you, Jay Hughes. I'm on at 6 o'clock tonight with JD. So So we'll see you all then. And thank you so much, Leslie. And we'll talk to you
Thank
soon.
you. Take
Thank
care.
you. Bye.
Bye-bye.